to my first guest, which is Dr. Matthew Pinto. Dr. Matthew Pinto is a weight specialist, obesity medicine specialist, as well as family medicine practitioner, right? Is that right?
That is sort of right.
You do, well, and aesthetic medicine, or you no longer practice family medicine?
Right, yeah. I sort of retired from family medicine. I focused all my practice on the obesity management and the aesthetics part of it. So I'm more of a wellness practice now, which I actually enjoy a lot more, and I feel like I help more people now, believe it or not, than I did as a family doctor.
I believe you probably do, because this obesity medicine is important. A lot of people struggle, and it's something that if you have a weight problem, chances are you'll have a weight problem forever. Even if you get thin, you still, it's management. You're right, it's management.
Yeah, and the biggest thing is, a few years ago, the AMA, the American Medical Association, finally looked at obesity as actually a disease. So before that, it wasn't actually, believe it or not, it wasn't considered a medical problem, and doctors couldn't even bill an insurance company saying that they treated someone for being obese. They had to, bill for, their high blood pressure or their diabetes, all things which are caused by the obesity usually. So it's interesting how it's changed. I've been doing obesity management for almost 7 years now, and it's changed a lot in just how it's looked upon by the medical community in general.
So I agree with you, because since I'm 25, I've had the same doctor, and I'm sure you know Dr. Louis Aroney.
Of course,
you know
I know him. So, I do know him, yeah.
Yeah, so Dr. Lou's been my internist since I'm 25 years old, long before obesity medicine became a thing. And I love the guy. I love the guy and I'm not fat anymore. I was fat years ago, but it's a constant. If your body is wired to be overweight, then people like me, I can't eat a lot of calories. And I say it to my listeners all the time, that's just my body type. It'd be great if it weren't, but it is. So how do you work with your patients who are struggling with their weight, and they do get to a holiday like Thanksgiving, and they're like, oh, I want to go crazy and eat everything, but I know that when you do that, you could screw yourself like the next 2 weeks.
Yeah, that's true. So it really depends on the patient, obviously. Everyone's an individual. It depends where they are in their weight loss journey. Have they been dieting? Have they been on making lifestyle changes for months, and have they already lost 50 pounds, and they're halfway to their goal? Or is it someone who's just starting out? Is it someone who's morbidly obese that is still very unhealthy? Or is it someone who only wanted to lose 20 pounds? So it really depends on the person. But I like to tell people that holidays should be special times. You should focus on your family and your friends, which is really the focus of the holiday, and the food isn't necessarily always the focus. But of course, food does, is usually part of it, especially for Thanksgiving. So it really depends on the person. Some people I give a little bit of free rein and say, it's your one day to kind of enjoy yourself, but you're still going to follow some basic guidelines that have got you to where you are now. And some people we recommend they really hardly eat anything other than the very specific things that they've been assigned to eat as part of their lifestyle change. But, there's lots of good Thanksgiving Day foods that we can enjoy that are actually not bad for us. It's simple switches that can make a big difference.
Okay. Well, and by the way, I want to mention that people can find you at vivecenter.com. That is your website. And can you do stuff online with people if they wanted to Skype with you or talk to you about possible?
We don't have something set up like that yet. However, they can email me. My email address is on the website.
Okay, cool.
It's pretty simple. It's just drpinto@vivecenter.com. And so I have interacted with people that way. We don't really have an online portion of our practice yet, but that is something we've been thinking about.
Yeah,
we're located in Marlton, New Jersey, which is not far from Philadelphia, probably about an hour and 45 minutes from Manhattan. So a lot of our patients are from this area because we do see them often. And it's a little hard if they're from far away, but we see our patients either weekly, biweekly, or monthly. When they're on a weight loss program. So
to offer them support. Yeah,
absolutely. That's the most important part, really.
It is important, and the idea that the not sort of the anti-shame mentality about it for many people, weight loss, it's a complicated issue. That it's not just a simple don't eat M&Ms and you'll be thin.
if it was as easy as, this is what unfortunately, most family doctors or internists that don't have any kind of training in obesity medicine have said to their patients, just eat less and exercise more.